Hello everybody. Welcome to the Home Safety Conference. Sorry about the photo there, I do apologise, but yeah, that's a lovely photo of me. I'm Nathan Davis, I'm the Head of Policy and Portfolio at RoSPA. I'll be taking us through as Chair for the conference for the next hour or so, and I'm looking forward to hearing the presentations. We've got a couple of different presentations which I'm sure you'll find interesting. There's some really good projects. And they're all about home safety, of course, and preparing us for the way that we're using our homes and what we can expect in the future. We know that change is inevitable, and the way that we're using our homes has changed, pre and post COVID, and it's continued to change. And that's given us some interesting challenges of what home safety means and the change to the way that we live our lives in our houses and homes. Loads of us have been spending much more time at home, and the house now becoming a workspace as well as a home, and a leisure place as well. And with people are expecting homes to be more comfortable, but using them in different ways. We know that energy prices are escalating significantly, fuel costs are going up, and people are more inclined to be sedentary and not travel as much, while at the same time households cutting costs and saving money. And what that means for us all is changing foods, changing cooking methods, not doing some of the maintenance that we want to do, or might be expected to do. And we need to be prepared to understand that and to recognise what that means for our families, friends and communities in terms of home safety, and stopping ourselves getting killed and seriously injured in the very place that we should be the most protected and well. So as a general theme, the presentations that we've got, really important, really interesting about work that is being done to keep a community safe and to learn about what is causing people to be injured and killed at home, and then what we can do about it. So yeah, I'm looking forward to it. Thank you for your time. You should see, if you're not familiar with this format, a question bar and a chat bar on the bottom right hand side of your screen. If you've got any questions, please post them in there to myself and the other hosts. And at the end of everybody's presentation, then I'll present those questions to the relevant person. That just helps the presenters to keep the flow and help us keep to time as we'll go through. So we've got about 20 minutes for each presentation, about 5 minutes for questions, and then at the end I'll do a wrap-up session, make sure we haven't missed anything out from there. So without further ado, I'd like to get straight into the first session, which I'm pleased to introduce Professor Denise Kendrick and Assistant Professor Matthew Jones from the University of Nottingham to talk about the Safe at Home National Home Safety Equipment Scheme that was run. I'll let them explain it, but we'll look forward to it. So I'll pass over to you guys.
Great, thanks very much, Nathan. Okay, so I'm Denise Kendrick. I'm going to kick off the presentation, and then Matthew's going to join us a bit later on. As Nathan has just said, we're going to be presenting results of a study which assesses the effectiveness and cost effectiveness of England's National Safety Equipment Scheme, which was called Safe at Home. Could I have the next slide, please? Thank you. The background to this is that we all know that avoidable injuries are a really important public health problem, that they predominantly affect children under 5, and these mainly occur in the home, and that there are steep social gradients. We know that with increasing disadvantage, the injury rate increases. The Safe at Home Home Safety Equipment Scheme was a government-funded scheme, and it ran across England. It ran between 2009 and 2011 and cost approximately £11 million. It was managed by RoSPA. It provided training for staff, free safety equipment, which was also fitted, and home safety education. It ran in 130 local authority areas, and these were areas which were chosen because they had hospital admission rates for injury in the under fives, which were higher than the national average. And within those local authority areas, it was aimed at low-income families with children under the age of 5 years. There has been one independent evaluation of this project to date conducted by the University of Nottingham that used mixed methods, so it used a range of surveys, interviews, observations and case studies, and it assessed effectiveness in terms of safety equipment possession and use, efficiency of the scheme and the acceptability. The evaluation found the scheme was very effectively managed. It was a huge undertaking, but was managed extremely well. They provided high quality training. It reached the families it intended to reach. Families and professionals both found it acceptable, and it also quantified the costs of the equipment and of training and of running the scheme generally. That evaluation was not set up to examine the impact on injury rates. Next slide, please. So the study that we're presenting today aimed to assess the impact of the Safe at Home scheme on hospital admission rates for injury in the under fives, and also to assess if the effectiveness varied by the amount of equipment fitted. We hypothesised that where more equipment was fitted, that the reduction in injury rates would be greater. We also aimed to assess the cost effectiveness of the Safe at Home scheme. We used a controlled interrupted time series analysis. This allowed us to compare changes in injury rates in areas where the Safe at Home scheme operated, which we've called intervention areas, and areas where the Safe at Home scheme didn't operate, which we've called control areas. We used a regression technique called negative binomial regression, and this allowed us to account for differences in injury rates in both the intervention and control areas before the Safe at Home scheme started, and also to account for variations according to season. Could I have the next slide, please? So we started off by mapping equipment fitting data which RoSPA provided to us onto small geographical areas called lower super output areas. These are areas which are used in the census, and they comprise between 1,000 and 3,000 people. This enabled us to identify the intervention areas and the control areas. The control areas were those areas in England where the Safe at Home scheme didn't operate, and also areas from Wales which didn't have the Safe at Home scheme at all. Each intervention lower super output area was matched onto one control lower super output area, and we matched them to make them as similar as possible on injury rates before the Safe at Home scheme started, on rurality and on deprivation scores. And we ended up with almost 9,500 intervention lower super output areas and the same number of control lower super output areas. So we compared changes in hospital admission rates for injuries before the scheme started for the 2 years during which the scheme was implemented, and then for the first 2 years after the scheme was implemented, and for the third and fourth years after the scheme was implemented. In total, the analysis included years from 2004 to 2015. We then did the same analysis, but we categorised it by the number of items of equipment fitted, and we categorised the equipment into 3 groups. We had a high equipment category, a medium equipment category, and a low equipment category. If I could have the next slide, please. So on this slide, the chart on the left shows how the equipment fitting occurred over time. Along the bottom, you have the 2 years of the implementation period, and up the left, up the y-axis, you have the cumulative percentage of homes with equipment. What you can see is that the scheme started early, but then the equipment fittings took off exponentially. But it took 17 months before half of the equipment was fitted. So in total, all of the equipment was only fitted right at the end of the 2-year period. On the right-hand side of this slide, it shows you the items and the types of equipment that was fitted. So in terms of the types of equipment, most families were provided with safety gates, cupboard locks, and bath or shower mats. They were the most common types of equipment fitted. And the average number of types of equipment each family had was 4. And then in terms of the number of items provided, the most common items were safety gates, cupboard locks and window restrictors, and the average number of items per family. So if I could have the next slide, please. This slide shows us some characteristics of children who are included in the study. So there were 940,000 children in the intervention areas and 911,000 in the control areas. 51% of children in both types of areas were male. And in terms of the ages at which they were admitted to hospital, you can see that most of the injuries occurred in the 1 to 2 year olds as expected, and that they were similar across both the intervention and control areas. I could have the next slide, please. So this slide shows trends in injury rates before, during, the first 2 years, and in the second, third, fourth years after the scheme ran. The black dots show the injury rates in the intervention lower super output areas, and the white dots show the injury rates in the control lower super output areas. And the solid green line shows injury rate aggregated across all the intervention lower super output areas, and the dotted green line shows the same but aggregated across all the control lower super output areas. So the before period refers to the 5 years before the scheme started, during refers to the 2 years during which the scheme was implemented, 1 to 2 are the first 2 years after the scheme ended, and years 3 to 4 are the third and fourth years after the scheme ended. What we can see on this slide is that prior to the scheme starting, so in the before period, you can see that the injury rates were slowly increasing in both the intervention and control areas, but there wasn't a difference between those changes in injury rates, so they were changing at about the same rate. In the 2 years during which the scheme was running, the injury rate increased more in the intervention areas than in the control areas. So you can see that the slope is steeper in the intervention areas than in the control area. In the first 2 years after the scheme was running, you can see that the slope decreased more in the intervention areas, but actually stayed about the same, perhaps slightly increased in the control areas. There was a significant difference between the intervention and control areas in this time period, and there was an 8% reduction over that 2 years in the intervention areas, but not in the control area. And then in the third and fourth years after the scheme ran, you see that the injury rates returned back to the levels they were at before the scheme started, and there was no significant difference between the intervention and control areas. Also, what we found was when we looked at amount of equipment that was fitted, we found that the reduction in injury rates increased as the amount of safety equipment increased. So areas that had more safety equipment fitted had lower injury rates. If I could have the next slide, please. Okay, I'm going to pass on to Matthew now.
Thank you very much, Denise. So I led the economic evaluation of the Safe at Home study. So we did this alongside the main study using the same data. But the thing to remember here is that whereas the main study looked at the time before the scheme was fitted or started, we actually used the implementation point. So that's those 2 years when the scheme was actually being delivered as our baseline. So we're looking at those last 6 years in the main study. We just looked at hospital admission costs, and we costed those using national tax. So we went to NHS reference costs and we dug out treatment specific costs for this. Okay, as I said, we've looked at sort of 3 points in time. So we defined the first point in time as the implementation phase, which is when the scheme was being delivered, and this was used as our baseline. We then had our first follow-up, which is the first 1 to 2 years after the scheme, and then we have T3, which is our second follow-up, which is years 3 to 4 after the scheme. Okay, and our primary outcome for the economic evaluation was the number of injuries avoided. Okay, could I have the next slide, please? So here's the initial results of our evaluation. The scheme cost £3,224 per local authority. So it would, if for each month you had to pay £3,224 to run the local to run the Safe at Home scheme. However, what we found is that the intervention areas had higher reductions in monthly hospital expenditure per local authority than in the control areas. So they were saving more money, and that there was a higher difference in monthly hospital admission rates. So there were more admissions being averted in the intervention areas compared to the control areas. Okay, so because of this, our our incremental cost effectiveness ratios for the increment per admission averted were for T2 versus T1, £6,862 per admission averted, and then this decreased to £4,209 for T3 versus T1 per admission averted. However, the most important thing to remember here is that the scheme cost was much, much greater than any healthcare savings generated just in terms of hospital expenditure or hospital admission expenditure. Hence, our cost offset ratios are actually very small. So, for example, for T2 versus T1, for every pound being spent on the intervention, you're getting 15 pence back in hospital expenditure. For T3 versus T1, you're only getting 29 pence back for every pound you've spent on the Safe at Home intervention. Could I have the next slide, please? So, just to briefly sum up, what we found in both the main study and the economic evaluation is that the provision of home safety equipment and advice is associated with a significant reduction in hospital admissions or significant number of injuries within children for under 5 for up to 2 years after equipment fitting. The injury rates reduced more in areas which received the most equipment. So areas which had higher levels of equipment fitted had lower injury rates or an increased reduction in injuries. The intervention cost was greater than any savings in healthcare, unfortunately, but we are likely to be underestimating the benefits. So certainly the economic evaluation doesn't take into account anything to do with any attendances at primary care, walk-in centres, so on. We only included short-term costs. We don't actually include any sort of wider costs to society as well, such as long-term care, education, lost productivity. And thank you very much for listening. I hope you found that interesting.
Thank you, Denise and Matthew. Yeah, I certainly very interesting and fascinating analysis of how you can evaluate the impact and the outputs from it. I don't know if anybody that's listening in has got any questions. And for me, it shows that the communities that are at risk, really benefit from the equipment that's been provided, and the rates of 30–40% uptake of the equipment across the piece. Really interesting, very simple costs. Do you think, as a question, we should be pushing more similar schemes from the data that you found?
Shall I take that, Matthew?
Yeah, basically.
Yeah. I mean, in terms of effectiveness, I think yes. I think arguing it in terms of cost effectiveness is more difficult. But as Matthew says, our analysis wasn't able to take into account the full range of costs and benefits. And the data just are not there to enable us to do that. We know we couldn't use A&E data because it's not. Injuries are not recorded in such a way that would enable us to do that. We couldn't use primary care data, walk-in centre data, minor injury unit data, and all of those things will have costs attached to them, which we weren't able to measure and include in our analysis. So I think certainly from an effectiveness point of view, I think as I said, it's harder to argue it from a cost effectiveness point of view, however.
Thank you, Denise. Much appreciated. Well, if you've got any questions, put them in the chat, and we'll pick them up at the end. But that point that you made there about getting the data from A&E and other areas is what Ashley Martin is going to talk to us about now. Ashley will be discussing the product safety data project. The pilot project has been supported by the PSS. And to establish what data exists within the hospital A&E departments and see what we can learn about it at accidents at home. So Ashley will be explaining the approach that's been taken to find out and some of the initial findings. So if you're there, Ashley, you want to take it over?
Yes, thank you, Nathan. Can everybody hear me? Yeah, so my name's Ashley Martin. I'm Public Health Advisor for RoSPA. And I just want to talk to you a little bit today about the product safety data pilot, and also with thanks to Geraldine Kosh. Many of you will know is an independent consultant, but has acted as project manager for RoSPA on this project and is responsible for some of the slides. So if I can have the next slide, please. That's just by way of background. Injuries caused by products quite often in the news these days, and just a few examples there. You'll have heard of injuries that have happened to children due to swallowing magnets, and this is not a new problem. You'll see, if the eagle-eyed amongst you might be able to see the date for that top story, 2012. So we've known about this problem for some time. What we can't tell you, and this follows on, I think, well, from the last presentation and Denise's comments, accident and emergency data is not set up in a way that we can tell you how many, how often, but we do know that they happen, and we do know hospitals all over the country report magnet injuries. And then you've got an illustration of a button battery that's been swallowed there, which do pose deadly risks to toddlers. And some other issues that have come up recently. Accidents with treadmills, for example, probably potentially more common in the home since everybody's been using the home since the COVID period as a place of exercise, as well as for work and as well as for living. So we're aware of these product related injuries. We're also aware of a lot of home related injuries, but what we need is some data to give us good insight into how we can tackle this. Can I have the next slide, please? The Office of Product Safety and Standards, which has supported this program, obviously is the key department, and one of the tools in its armor is to issue safety alerts, and that's just an illustration of one, also related to the magnetic products. And clearly, products that cause a problem can be identified in a number of ways. Obviously, trading standards officers and those responsible for enforcing product safety standards can review the market and see products that do not meet standards and regulations, and this is one way in which the public can be alerted, and in some cases the product's withdrawn. But obviously, what is also important is the data to support such action. Can I have the next slide, please? So we need good data on accidents in the home and those that involve products, so that we can inform action. Denise has already alluded to the fact that we don't currently have that good data from our accidents and emergency departments. It's not that data isn't there; the data is there, but ways in which we can get that data out is the issue. Many of you on this webinar will be aware of the Home Accident Surveillance System and the Leisure Accident Surveillance System, which between 1978 and 2002 provided excellent data on accidents that happened in the home and accidents related to products. Very sadly, that was withdrawn in 2002. And since then, we haven't had that sort of clear set of data to work with. So what about the other sources? Well, Denise has already mentioned about accident and emergency. Hospital admissions data is quite useful in terms of at least identifying types of accidents, so falls, foreign body injuries, cuts, and so on. But it doesn't get into the detail of products that might be involved, or sort of quite how those accidents occur. Deaths data, mercifully amongst young children, there are only a small number of deaths, but there are deaths each year. There's over 6,000 home accident deaths every year. So we have some detail on those, and there's around 60 children under the age of 5 who die as a result of a home accident. So we have some detail. The National Child Mortality Database has been an excellent addition to that data that we can look at. But there's really sort of again, not real clear data on products involved and how those accidents occur. The emergency care data set is a recent arrival on the scene, and in a sense, this has been the starting point for the pilot project commissioned by the Office of Product Safety and Standards that RoSPA has been delivering, and it's much of the data that we're using is based on the emergency care data set. So if I can have the next slide, please. Now, you're not expected to read that sort of picture on the right, but it just illustrates that actually the problem isn't the taking of data. Anybody who's been to a hospital recently will know that lots of data is taken, copious amounts of data, and repeatedly as you make your journey through the hospital. But it's how useful and usable is that data. And this sheet is just these are some triage notes, and what became clear from looking at some triage notes was that sometimes information about the type of accident and the product involved is included in triage notes. So, for example, this is an accident that happened with a hoverboard where a child was injured, sort of falling off a hoverboard. Now, we may not be able to do much about children falling off hoverboards, but again, I go back to the point that we don't really know how many hoverboard accidents happen each year, but we do know that they've become increasingly common just from hospitals' anecdotal reports of the number of injuries they see as a result. Can I have the next slide, please? So the objective of this project was to deliver a pilot program with a small sample of hospital accident emergency departments that explored the feasibility of collecting product data from free text. We wanted to look at the quality and representation of the data, the willingness of staff and motivation required to collect and analyze that data, and the format the extracted data would come in, and the sort of time and resource required to analyze it. Can I have the next slide, please? So we worked with 4 hospitals in principle. They're listed there. We did work with a couple of additional hospitals, but for various reasons they weren't able to continue with the project. And those 2 organisations at the bottom, NEL CSU and Arden Gem, those are commissioning support units that provide sort of support services, data services, and other services for hospitals, and they've supported in providing data cleaning and analysis. So it's been a team effort working with those hospitals and organisations. Next slide, please. Working with those hospitals, we set up a data protocol which set out the data we were looking for, how to receive that data, and what would be done with that data. That's just a list of the fields that we asked hospitals to provide the data on. All of those are included in the emergency care data set, so we weren't asking hospitals to provide us with any data that they don't already collect. That was a very important part of the program. We did not want to put additional burdens on hospitals, and obviously it's unrealistic to start asking for them to provide specific data on particular products. We needed to work with what the hospitals were already collecting. And if I can have the next slide, please. But the free text was really the key ingredient we were looking for, because it might provide vital data on the nature of the event, the type of the product involved, and really some of the the background to why an accident happened. Many of those other fields very important. They'll give us the age breakdown. They'll give us the gender breakdown and so on. They may give us the location breakdown insofar as that's recorded, but the free text was what we were really looking for in terms of giving us the richness of additional data. But it has to be noted that obviously data protection has been a key element of this project. At no point did we ask for personal identifiable data, and in fact all personal identifiable data that might inadvertently be there had to be removed, and that included any field that had free text. It was also complex because there isn't just one box that says free text. There are sort of various opportunities within the data fields to sort of add free text, and so we found them in under a variety of different headings. So that made the analysis a bit more complex, and more care needed to be taken in terms of what we were looking for and what the hospitals were providing us. Next slide, please. So once we'd received the data, there was a great deal of data processing that needed to take place, and this is the work that Nell CSU and Arden Gem have undertaken for us, in terms of removing records that described events unrelated to product injuries. These might have covered topics such as injuries arising from violence, self-harm, substance abuse, arrest, frailty, medical emergencies, diagnostic reports, and complications arising from prior medical care. So obviously all very important areas, but not areas we're interested in from an unintentional injuries point of view. And we realise there are great complexities sometimes in determining what is an unintentional injury and what is an intentional injury, but it is important to tease out the difference. Removing any patient identifiers, as I've mentioned, was very important. Many of these could be removed automatically in terms of names, addresses, and so on. But obviously, some of these were referred to in free text boxes, and so needed to be cleared. Some software was developed to help do that, but there was also a great deal of sort of needed to go through the records manually. Removing of the social context of the injury also had to take place. So this included things like swapping out terms like father and exchanging that for parent, or sister to sibling, aunt to relative. Anything that might cause a patient to be identified was removed. And then obviously some of the records were very long and needed to be truncated, but that was a question of just editing to make sure that the key information about the injury was included. Next slide, please. So this slide just is from the first 2 years of the project, which shows the number of records we received from the 4 participating hospitals at that time. The number of records that were kind of retained as being relevant to the project, but also if you look further down, you'll see some of the complexities in terms of the fields that we asked for were not necessarily always the fields that we got, because we asked every hospital for the same fields, but obviously not every hospital was able to provide the fields. The ones with the red box, they couldn't provide that. Those particular hospitals couldn't provide that data. The ones with the triangles, it was just they provided only the partial data for that. If you look across, you'll note there's a very significant difference in the numbers between the hospitals 1 and 2 and sites 3 and 4. That's partly because site 4 was only providing child accident emergency data, and site 3 took it a step further and took it on upon themselves to further interpret what we'd asked for, and only provided a specific information really on childhood poisonings, I think it was. So again, that was an area where we kind of like sort of lost a little bit of control to the site, so we didn't get the data we fully wanted. Next slide, please. Just continuing from that, that site 3 unfortunately was not able to continue with the project for the year 3. So for the 3rd year of data, which is still being analysed, we do still have 4 sites, and I think we've clarified some of those issues. So we will have a much more significant number of data there. There's some examples of the free text that on one side of that table, and then some of the categories that came up quite a lot. Now, obviously, we're not particularly interested in the sporting injuries. That's not relevant to this particular project. So things like football and rugby and so on. But you'll see products do crop up quite a bit in terms of trampolines, scooters, sofas and chairs, beds, tables, coins, batteries. So there are a lot of quite common themes that have come up, and ones that we have been sort of working on recently. Next slide, please. And these are just some examples of some of the free text information that we've got. These are ones around magnets, and one of the key things to note is that it's very seldom that it comes up that a child has swallowed a magnet. Multiple magnets, which are of course the problem in terms of if a child swallows more than one magnet, that's when the real health issues arise. So you've got one where swallowed 2 magnets and one where swallowed 6 magnets. So that's sort of if we could be getting that sort of data from sort of a multiple number of hospitals, then that would give us much clearer information as to how many, how often, and the extent of the injuries. Next slide, please. And those are just some more, and I know it's quite small print, so you may not be able to read that, but you can see that button batteries, fireworks, polystyrene balls, a glow stick, sort of things that came up, and providing some richer information about how those incidents happened, where and when they happened, which is all useful information. Next slide, please. This is just an example to highlight. This is not the full total of button battery examples that we came across from these 4 hospitals, but it is a snapshot, and really the point being that that it really just confirms that the age group, age 0 to 4, is that age group where this is the most risk in terms of button batteries. On the other side, you can see that that button battery injuries are classified in very different ways when it comes to the mechanism. Sometimes it's a foreign body, sometimes it's a burn, sometimes it's a poisoning, sometimes it's a blunt injury. Now, some of that may be down to kind of like how the clinician decides to categorize it at the time. It's interesting that most of them are sort of categorized as foreign bodies, because I guess they are swallowed and regarded as a foreign body, but the actual injury that they leave is not quite the same as if a child puts other things into their mouths, which might cause choking injuries, or obviously the injury in related button battery is very much a sort of, if you like, a burn related, often an internal burn related injury. Next slide, please. So this is just a snapshot of the process we've got to. There have been challenges. I've already mentioned challenges with the sites and in terms of the sites understanding what we need. And also the fact that every site has different methods of recording, different priorities in terms of how they record data, different systems, and so that's been sort of quite an obstacle. There's obviously some sites have had technical difficulties in extracting the data. One site that we originally worked with in year 1 had to pull out because they could extract data but not in a meaningful way that could be analysed. The consistency of the data, as you've seen, is variable from hospital to hospital. And contacts have changed over the time. We've coined the frame in terms of the partnership of the willing, and we are very greatly indebted to clinicians at those various hospitals who've been really invested in this project and really given a lot of time to this project. But it has relied on their willingness and their resilience to do that. And COVID-19, as you can imagine, we're dealing with frontline hospitals here, so that has been a significant factor in some of the delays in this project, and also in us being able to directly visit the hospitals to explain what we're doing and to and to work more closely with them as we originally envisaged. On the right hand side, you'll just see the many spellings of just one thing, trampolines, which just is an illustration of how complicated it gets in terms of really analysing this and sort of and searching for that information. So that's just an illustration. Next slide, please. Our next steps are to continue to analyse the 2019 and 20 data, which has been submitted to the Office of Product Safety and Standards and for further analysis, to do some data cleaning on the 2021 and data. That analysis is nearly complete. To do some initial analysis on some key products like magnets, like button batteries, like e-scooters, which are all very topical at the moment. And we are in the process of developing a final report and the next steps proposal. And the final report will contain much of the data. Some of you may be frustrated that I haven't really said a lot about the actual data and results from the data. We can't say that at the moment because obviously we're still going through that process and working with OPSS on that, but that's certainly the plan. So so those are the next steps, and a final report will hopefully be available in due course. Next slide. I think it's my final slide. Hello, next slide, please.
We've lost Kate there, Ashley, but
okay, not to worry.
While we go on, thank you, Ashley.
Thank you. Yeah. I was just to say, clearly there have been huge complexities in gathering, cleaning, and analysing this data, but we also believe there's huge opportunities to inform future safety activity. You know, if we can get to the stage where we can collect and analyse this data from a larger number of hospitals, then I have no doubt that this could be sort of a good way forward in terms of using hospital data. Thank you.
Thanks, Ashley. Thank you. Really important stuff, and well, Ashley knows well. I think this is a fundamentally important programme that's running. So I'm really looking forward to looking some fine detail from the analysis. There's a couple of questions in the chat, but just while I prepare those, Ashley, from what you've learned so far, what would you say is the greatest hurdle to unlocking the data that's available from the A&E staff that you found?
I think getting that sort of consistent. I mean, obviously, once we put aside the data protection aspect, which is obviously critical, and the process of that is different in every hospital as well. So that was a surprise to us. You know, there isn't one clear-cut process. One hospital required a different process to another hospital, and so on. So once we passed that, I think the fact that, you know, there may be an assumption that all NHS data is collected in the same way and consistently. That is not the case, and so it is bringing those different data sources together, and then that's where that analysis and having somebody who's having time to kind of like sort of to assimilate that data is vital, I think.
Thank you, Ashley. Yes, it's an enormous job. So a couple of comments I've got from Michael Watson. Injury data is very important for developing local and national initiatives. I can heartily agree with that. Communities setting priorities, national initiatives, plan activities, raising awareness, promoting action and programme evaluation. You mentioned HASLAS, and was it expensive? I can't give you a number, but I'd say that actually it was really, really valuable. That's a bit trite, but I don't know, Ashley, if you could give any of your experience on how much it actually cost.
Yeah, I don't know. I mean, one about, I think something like £1.5 million comes to mind, but you know, which in the grand scheme of things was not a huge budget. I do think it was a huge loss. I do think it was short-sighted, and I do think that not that we necessarily want to go back to a HAS, but we need something similar, and I think this has demonstrated the need for that. Interestingly, some 10 years after HAS was kind of like disappeared, government departments in their sort of their impact assessment statements of kind of like when they were looking at legislation, for example, the toy safety regulations that we have now, they were using HAS data from 2002 to highlight the importance of this type of legislation. So even many years after HAS finished, even government departments, dare I say, the government department that ended HAS was using it quite widely to kind of like to justify their own sort of work.
Okay. Thanks, Ashley. So the question again from Michael about making to ensure data from A&E primary care is more accessible to local and national practitioners. You mentioned about data protection agreements. Would you agree with that?
Sorry, say that again.
So what action should be taken to ensure data from A&E and primary care is more accessible to local and national practitioners?
Yes, I think that's very, very true. I think the more accessible we can make it, the better. Of course, there are data protection issues, and of course, the smaller the area you work in, then the more that issue becomes an issue, because you may be working with smaller numbers. But I think if we can find ways around that, and I mean in some ways, to inform the work, it's not always necessary to kind of like to know sort of the situation just for your specific area. I mean, we know a lot of Denise and Matthew also alluded to this. We know a lot of things about accidents, for example, that happen to children anyway. We know from that children will put things in their mouths. We know that children are the ones that children under 5 and even under 3 are the ones that predominantly the ones turning up at hospital and A&Es. So there's a lot of work that we can do, but obviously the more detail we have on what's causing those accidents and why they're happening, so much the better.
Thank you. There's a question here. I realise that we're running over slightly. So there's a question here from Magnus Hadley about the data set, including information from admissions from paramedics. Would it be possible to include it from ambulance trusts to a broader depth of information? I think, and the questions from Caroline and Denise there, and Michael again about giving us the forward notification, us in general in the forward notification of the trends of what's changing. I think actually the proposals for the next steps to continue to grow or to refine this project will need to come in the next couple of months to see exactly how best to continue it, to capture this data. Because it's for me, it's too important that we lose it or we don't have access to it and we can't use it. So, is there anything else you want to add to that, Ashley?
Yeah, no, I would agree with that. On ambulance data, yes, that's certainly something to look at. I think we will find the same thing as with the other health data, that there isn't a simple data set that one will be able to go to and interrogate. So it will be about working with ambulance services as partners to try and build that in. And then, yes, in terms of the giving the early notification of new products or products that may be causing issues, yeah, that is so important. But what you're really talking about there is a surveillance system that is kind of like very up to the minute. And yeah, we'd love to have that, but that's probably some way off.
Thank you, Ashley. We'll continue, we being RoSPA will continue to work on that and put the proposal together, which those in the Home Safety Committee and others will see and have opportunity to get involved in shaping. I'd like to move on, slightly behind time, apologies. I'd like to move on to Sue Bede from the Office for Product Safety and Standards. Sue, specialist, is going to give us an overview of the retained EU law bill, which is having a reading in the House of Lords today. What it means, how we can expect it to impact product safety regulations, and some insight into the product safety review. So Sue, over to you.
Thanks very much, Nathan, and delighted to be here. So yes, I was hoping to talk in a bit more detail about our product safety review, but for various reasons, we've still not managed to publish the consultation, but I will touch on it. But first, I thought I'd go through the retained EU law bill, because it's my role as head of legislation for the Office for Product Safety and Standards to fundamentally make sure that only safe products are bought by consumers and are placed on the market, in the hope that at least that starts to prevent some accidents from happening. So, retained EU law bill. If I could have the next slide, Kate, please. Retained EU law, or rule, is a term that you may have heard bandied about, but what does it actually mean? So it's an acronym which stands for retained EU law, and that's a category of domestic law that was created at the end of the transition period, so when the UK left the EU. So when the decision was taken for the UK to leave the EU, the law that was existing that we followed in the EU had to be lifted and shifted, or cut and paste into our own statute book, so that we actually had some laws that functioned when we left the EU. Then the UK introduced the EU Withdrawal Act, and that made that the legal framework to follow, but it was never intended to remain in place forever. So a new bill, the Retained EU Law Revocation and Reform Bill, or the Rule Bill, has been introduced to give government powers to make sure that changes to retained EU law can be made in the best interests of the UK now that we are in effect out on our own. First of all, we've had to identify all of the regulations that make up retained EU law, and some of you may be familiar with a consumer dashboard that's in the public domain. Currently has about 3,700 pieces of rule on it from across all government departments. So initially we were told that rule constituted a particular definition. So for product safety and also weights and measures that we look after, you'll find about 40 pieces of law on there. That's not the full list. We've continued to keep it under review and constantly update, and we will soon be making an update to that dashboard, which I think will demonstrate in the region of about 170 pieces of retained EU law that cover product safety and weights and measures. This also includes the elements for implementation in Northern Ireland as well. I've got that sort of little arrow on the bottom there because the thing that sort of strikes me is that we started with the European Communities Act in 1972, and that stayed in place for about 46 years. Until we exited the EU and had the EU Withdrawal Act. And now the Rule Bill has a sunset on it for the end of 2023, by which time, unless we do something with those laws, they will be sunset. So in effect, they will fall off the edge of the cliff, but I have a plan. But the reason that I've sort of set that out is it just strikes me that we've had 46 years of rule, as it were, only to potentially obliterate it within a mere 5 years afterwards. Next slide, please. So what does this, what's happened to the bill? Because I'm sure you will have heard about it. So it went through the House of Commons last month. It's now moved into the House of Lords, and we've started to have considerable number of debates on it, as the Lords absolutely love the level of the detail. We have committee stage later on this afternoon and into the early evening. If you have nothing on later, I'm sure you will be able to follow it. And we're seeing increasingly consumer safety and product safety being raised, and in particular the Lords seeking to carve out and preserve certain regulations. Some of the powers that are in the bill, though, will be useful for us to deliver some of our product safety review, which I'll come on to, and also present an opportunity to improve some of the legislation that my team and I did just lift and shift onto the statute book, and where we have found that some of it is not actually working too well at the moment. So as part of our review, we'll be looking to gather insight from people around potential regulations that could be amended using the retained EU law bill to work a bit better. The next one, please. So what does the bill actually do? What does it all mean? How is it going to impact us? Fundamentally, it has introduces a number of powers that are focused on amending, repealing, revoking, or changing in some way the existing retained EU law. You can only use them, though, provided that you reduce burdens for business, so make changes to improve the law as it was. And also there is a power to sunset all the retained EU law at the end of 2023. So this means that unless further legislative action is taken, those regulations or laws will cease to be effective after this date. We can use the bill to extend the sunset date or ask to preserve some of the retained EU law, but you must demonstrate that it should be kept. And so this is clearly what we're working on in the background with our ministers, to demonstrate that we can't envisage a world without product safety laws or without laws to ensure that weights and measures are accurate going forward. The bill also has elements of looking after case law, so it makes the domestic court the overriding area where we should review cases, not the retained case law that had previously been used, and also allows for other bits of retained EU law to be changed by secondary rather than primary legislation. So, for example, some of the elements that the Consumer Protection Act are used to implement some of the retained EU law, we can continue to make changes to that by secondary rather than primary legislation, which will make a lot of difference and save a lot of time, particularly where we are within the parliamentary cycle. The retained EU law bill also removes the business impact target. Big sigh from civil servants here. So whenever we wanted to amend legislation or introduce new regulations, we would have to demonstrate that we were saving money elsewhere. So that target will now be removed by this bill. And then I don't know who comes up with this terminology, but it will also allow for us to assimilate law. So in effect, that means we can preserve it. It becomes assimilated law and remains on the statute book. So fundamentally, what we would be keen to do in the Office for Product Safety and Standards is to see all of our product safety and legal metrology regulations preserved and assimilated, and then that will allow us to bid for our own primary legislation to change them in the future. At this stage, I'm not able to guarantee that that's going to happen, but I just want to reassure people that that is what we will be seeking our new Secretary of State to agree to. And the reason that I can at least push for that is because I have a clear plan for trying to then subsequently review all of this law. Because fundamentally, it was literally sort of a cut and paste job, as it were, onto the statute book. And we know that some of it doesn't work that well. We know some of it is burdensome and could be changed. So it is a good time to review all of those regulations and have the opportunity to amend them in the best interests of consumers and businesses going forward. I could have the next slide, Kate, please. So one of the things that the retained EU law bill does allow us to do is to make changes to that, to the retained EU law that it covers. And so, from my perspective and my team's perspective, if we could find a few quick wins as we're we're calling them, we could make changes to those regulations. They would automatically be preserved as soon as you make a change to them. And it would also allow us to do some of our post-EU exit fixes, things that have been raised by industry. So as part of the product safety review, we'll be calling on stakeholders to come forward with ideas that they may have been made aware of or know where we could make changes to those regulations to improve them. I've already got a bit of a list around, as I've mentioned, those EU exit fixes, so things that have been raised by industry. So there's some issues around pressure equipment and the certification requirements. Aerosols industry has talked to us about some labelling changes that they think would be beneficial, changes into pyrotechnics. So those are all things that we definitely know about. And we're also starting to have some conversations around other areas. So, for example, thinking about the labelling changes, we've got easements in place whilst we continue to accept CE marked goods to allow for that transition for business. And those labelling changes are around having sticky labels or the detail on accompanying documentation. So we're considering whether we should make those permanent. Some of the product schedules, toys, for example, electrical equipment, has those easements permanently written in. So there's a bit of a precedent set there, but we think fundamentally that would help business and would also help for plans around e-labelling, which I'll cover off in a minute. We've also had representation from industry, for example, cricket PPE, where some of the industry has said that all cricket PPE requires third-party testing, and you might expect that certainly for the helmets, for example, that where they stop a cricket ball come crashing towards you. But some other elements of the padding, the industry is suggesting that it doesn't necessarily need third-party testing. It might just be suitable for self-certification. So again, we believe the retained EU law bill would allow us to make that change to the PPE regulations if we had the evidence to see that as a positive change. And obviously with Ashley's presentation around accidents, etc., it's interesting to see, although not directly looking at some of the sporting industries, but I didn't spot cricket there. But those are the sorts of bits of evidence that we would be looking at as well. The other thing that we're expecting the retained EU law bill to help us introduce is a move towards electronic labelling. So this is something that is being championed by industry. We see that it would be beneficial for consumers as well, although our intention is not to introduce for consumers in the immediate short term. We would be looking to work with organisations like RoSPA to make sure that we got that element of it right. But essentially, Prime Minister, 3 Prime Ministers ago, I think it was, Boris Johnson, has pushed for electronic labelling to be introduced. It's not something that the EU is particularly keen on, so we would be looking to do it on a voluntary basis. But certainly the tech sector, many are already using it. So if you have an iPhone and go into the settings section and the legal regulation bit, you will see the UKCA marking, the CE marking, various other markings all set out electronically there. So we're quite keen to use the retained EU law bill to allow for electronic labelling by manufacturers for the information that manufacturers are required to ensure are delivered with the product along with the relevant marking, and use that for screen devices or devices that are supported by a screen. So we envisage here sort of using a QR code to screen for the information. And then our thinking is that in the future, similarly, consumers would be able to scan a QR code to get all of the information about the product. There could be some way of, for example, sending information about a product before the product was received, particularly if you were ordering something like I don't know, an iPhone, you would get all the information about it that you could review before actually receiving the product. So this also ties in, as I've said, with the labelling changes, where we're thinking about making the current easements permanent, so that would allow businesses to consider moving to e-labelling, but without having to think about reverting back to indelible marking and marking every product in the interim whilst they made the business planning process into that. So these are all sort of quick wins that the retained EU law bill could deliver, which would help us also materially preserve those regulations that we made amendments to as soon as we were able to, once the bill has passed. Next one, please, Kate. So now on to our product safety review, which is fundamentally our delivery mechanism for reviewing all of our retained EU law. The next one, thanks. So essentially our review kicked off probably in about the end of 2019 now, and we ran a call for evidence through 2021. And we are ready to hopefully publish a consultation very soon. We're essentially covering 5 kind of key areas. So it chimed a lot with the talk about from Ashley's presentation about the data, which obviously OPSS are working with RoSPA with, because what we're quite keen and have been exploring is currently the regulations are set up. There's lots of individual regulations, and these are set out all the prescriptive nature, but we are quite keen to perhaps simplify some of that and look at particularly the hazard presented by a product. And the reason that this has come forward is because what we tend to see, and again, many of the examples of accidents where the data has been collected is things like e-scooters, hoverboards, all the sorts of sort of newish products that tend to just fall into the general product safety directive because they don't have a specific product regulation applicable to them. So, but also, whilst they might be deemed safe in terms of a product, it's their misuse that potentially presents the higher hazard. So we're looking at whether, as part of our review, we should consider reducing compliance costs for those lower risk products and reducing the need for unnecessary conformity assessment, but also thinking about the hazard presented by the product and therefore whether the relevant essential safety requirements and conformity requirements should meet that. One of the reasons for doing this as well is that most of those regulations that have been lifted and shifted into our law to become our retained EU law have been in place for 30 or 40 years. So, for example, a widget that 30 years ago was quite highly innovative and potentially required that third-party assessment may now be something fairly innocuous and may therefore fit more likely in only needing self-certification, and plus given the incidents that we've seen and thinking about where that sense of harm comes from. But fundamentally, what we're trying to look at and what we want to discuss once we can get the consultation out is thinking about the balance between regulations, industry-led standards, making the framework itself more responsive and agile. So, for example, once we see a range of incidents having come forward, that we can do something more quickly with the legislation to take action, rather than where we are at the moment, where we do lack the powers to make any changes, but also to allow business the option to innovate, bring products to market more quickly, while still ensuring that they're safe. The call for evidence that we had also kind of told us or gave evidence that showed us that how we buy products, how we use products is very different these days. So we need to think about digital solutions. So thinking about e-labeling, thinking about how digital options can also reduce burdens and improve the consumer experience, which also plays into all the evidence that we had about the number, or the ease rather, with which unsafe products can be sold online, and the fact that there are limited responsibilities on online marketplaces, for example. So the review will be looking to explore how we can create a more fair, level playing field so that shopping online is as safe as shopping on the high street. And I think one of the challenges there is the range of products that's available online, as opposed to perhaps a more narrower scope of products that you can buy on the high street. And then finally, the other area that we'll be looking at is enforcement and compliance, because to all intents and purposes, there's little point in putting additional responsibilities on online marketplaces if you can't enforce them. So we'll be looking at trying to think about the leadership and coordination role of OPSS, and addressing some enforcement gaps. So ideally seeking and securing primary legislation to allow us to have greater powers in that area. Next one, Kate, thanks. So one of the questions that we're kind of going out, and I'll leave you to think about this, and perhaps you can hopefully feedback some ideas, is are there any sort of specific products or processes or procedures where we could take action within the current product safety framework? So any of those regulations that I could amend or change to reduce business burden, encourage innovation, and make sure that consumers are not compromised in terms of safety. So if you've got any ideas, think red tape challenge slightly repackaged. I had the pleasure of running a couple of red tape challenges a few years ago. For those even older contingent, it's the Heseltine question, or more recently the Jacob Rees-Mogg Sun initiative. So any ideas there, or anything that might have been contributed to any of those that never got taken up, then do let me know, and we will investigate so that we can start to deliver on the retained EU law and encompass them as part of our wider reviewing of every regulation that we have responsibility for, to make sure that it continues to work. Thank you. Next one, Kate. And really just final one around what the next steps are. So we do hope that to publish the consultation very soon. We've been held up for various political reasons, not in the least changes of Prime Minister and Minister, and won't have escaped your notice that the Business Department has now become the Business and Trade Department. So just waiting for final clearance. We would then have that consultation open for 10 weeks. And we'll be running a series of stakeholder events and roundtables to help gather evidence. Because, you know, we have been waiting to publish for a while, our internal thinking is starting to get much more developed. So it would be good that we will be able to discuss that once the consultation is out. Very keen to research quick wins and seek delivery via the retained EU law bill. And then fundamentally, we would have to draft a government response to the consultation, but that is some way down the line. Behind the scenes, we're quite keen to explore securing primary legislation to allow us to implement the proposals from the product safety review. So particularly around online, but I am also exploring the other legislative options that we've got. Thanks very much, Nathan. I think there's 2 or 3 questions in the chat. I'll try and have a look at.
Thank you, Sue. That was brilliant. There's so much information there. I know for a fact that you're enormously busy. This is a massive challenge. A couple of comments are reflected in there. Michael Watson, and then a comment from Michelle McKenna about rule having a clear focus to ease the burden on the business and industry, rather than consumer protection. And that's on the back of that. It's one of the things that RoSPA are really keen on, and not just in the product safety sphere, but across all the legislative sphere in all our lives, really, is that we don't lose anything that's hard-won is going to cause people to get killed or seriously injured. And I know you mentioned a couple of times that obviously that's the opposite of what anything to achieve, but we're concerned about that. And just my phone's been pinging off because the bills are being read in the Lords now. So we'll see what happens. We've just for your benefit and everybody else, we put an amendment in that anything that is safety related that's going to be removed, we've asked for a published safety impact assessment to be produced for it. Because we're concerned that if there is a wholesale bonfire of regulation on the 31st of December, that's going to negatively affect all our lives. So from my point of view and RoSPA's point of view, we recognise the work that Tess and your team have been putting into to work on what to save stuff and to improve standards, which is great. And we've got the campaign of Protect Our People to encourage ministers to vote the right way and make what we see as to be the right decision. So I won't ask you to comment on that, Sue, but I'll just flag that up to the delegates if they are interested, please have a look at the RoSPA Protecting Our People campaign and sign on if they can. But going back to the maintaining and then improving consumer protection is obviously what we're hoping to see, and I think that came through to me that's what you're looking to do. Is that fair?
Yeah, I think so. And just sort of coming back to Michelle's points that the rule bill has a clear focus to ease burden on business and industry. Absolutely, it's political rhetoric fundamentally. No focus on improving protections for consumers. I agree. I think the rule bill at best will be able to just maintain what we have for consumers. But in terms of the product safety review, we have quite a big section in the consultation around improvements for consumers, better information made available, particularly when purchasing online, so that they can make more informed purchasing, and trying to think about things around cost of living and the way that perhaps consumers are purchasing things, but making sure that they are better protected. So that will come out loud and clear through the product safety review. If I just pick up Michelle's other point as well, in terms of little point in putting regulations on online marketplaces if they can't be enforced, is it not that rule would prevent the introduction of regulation on online marketplaces? Yeah, the rule bill prevents the introduction of regulation on online marketplaces because it would be imposing new burdens on different businesses, because online marketplaces are not captured under the current definitions. But the way that I would seek to address that is by securing my own primary legislation to allow us to do that. We're also exploring the Consumer Protection Act. My concern there is that whilst I can probably use powers in the Act to impose requirements on online marketplaces or change the definitions to capture them, the Consumer Protection Act enforcement powers don't go far enough. So again, they're only extended to kind of inspections on physical premises. They don't allow for definition of around fulfillment house. So I would need to find alternative regulations somehow to amend or change or improve to allow for that enforcement. And this has been the big stumbling block. And this is my own view between kind of the rhetoric of retained EU law and the reality of having limited powers to do anything. So for those of you who are familiar with the product safety and legal metrology regulations from the EU exit that are wrapped up in the affectionately named Mega SI, the powers in there's 13 powers in there, very, very limited. And so this is why ever since we left the EU, my team have been trying to push for getting primary legislation, at least to cover product safety, to give us the fundamental ability to make more radical changes to take account of the different ways in which consumers buy products and are supplied with products as times move on. So that is the way to do it. Less concerned on the weights and measures side, because we do have the Weights and Measures Act 85, even though it is a little bit out of date. I've fundamentally got a set of principal powers to allow me to make changes to that secondary retained EU law, where we don't have that in product safety. So it's important to me to get that primary legislation to start to make a lot of changes.
Steve, thank you very much. Thank you. And there's one final comment from Ben Turner about lithium-ion batteries, which I know are becoming more recognised as an issue with fire and rescue and home safety. I think we should pick that up outside. So apologies, Ben, but yeah, it is important. It is on the radar, but we need to pick that up. And on that note, I realise that, excuse the term, when I burned up our timings of the agenda, but I'd like to move straight on to Jed Devereux, if that's okay. Jed's the strategic the deadly effects of cost and what he's seen from these terrible incidents that are happening. So, Jed, to you, and apologies about running late.
No problem. Listen, thanks for that seamless sort of handover, Nathan. And the point is not lost on me in terms of emerging technologies and the work that we need to do across government to actually look at the rising issues there. What I'm really going to focus on, my name's Jed Devereux, I'm Strategic Health Lead for the NFCC. The NFCC is the National Fire Chiefs Council, and it's the representative body for all UK fire and rescue services. I'm mainly going to focus on the work that we've done in terms of the cost of living rise and the approach of the sector and I'll probably, for the purposes of this, will focus on sort of English fire and rescue services, but certainly working with the devolved nations, Northern Ireland, Wales and Scotland, the NFCC sought to actually address or sort of preempt what we see as being a rising sort of risk and risk stratification in terms of fuel poor homes. Next slide, please. Okay, so I mean, this is well trodden ground, and given the sort of time that we've got, I probably won't dwell too much on this. And this has been well trailed in every media outlet and every sort of conversation up and down the UK itself in terms of the impacts in terms of rising inflation, but more specifically, and the focus really is in terms of the effect this has had on the European situation has had on the energy market and the rises associated with that. So in terms of the latest data on that and the fuel poverty fact sheet, which was released today, which was looking at England in 2022, we've seen 13.4% of households are now considered to be fuel poor in 2022. And that's a significant rise from previous years. That equates about 3.26, probably about 3.3 million households that we know that are experiencing fuel poverty. And that gap in terms of that expenditure has gone up from a gap of £338 in 2022 and has risen from £254 in 2021. And obviously, in terms of the amendments, which is in the government's hands, in terms of the fuel poverty gap, which will be reviewed again on the 1st of April, could have consequences again in terms of people's ability to effectively heat their homes and to look at the methodologies for cooking. And that's not to say that the government will not address that, but it's just to be there on the horizon. And obviously, we'll have a budget before that, so we'll probably see some steps put in place to actually ameliorate some of those potential increasing sort of costs. Next slide, please. So why does it matter in terms of, from a fire and rescue services perspective, in terms of fuel poverty and rising fuel costs that we see, and the impact that that would have on our households, and more pertinently in terms of the agenda today, in terms of promoting home safety? Fire and rescue services are no stranger to running winter safety campaigns, and each year we do so over a range of challenges, be those challenges in terms of people being at more danger in terms of both within their home and within the area, the vicinity around their home, in terms of experiencing accidents, or people promoting models of independence and support for individuals, especially vulnerable adults, in the winter months. It just doesn't impact on us as a sector in terms of prevention, but also in terms of, from a cost of living perspective, it's having ramifications for our protection function, and that's mainly towards commercial businesses and also our response function. So we're seeing it much more in terms of spiking of incidents, which I'll talk a little bit more about towards the end of the presentation, around the types of incidents that we're actually responding to, and also the types of issues that we're coming across in terms of commercial premises when we're trying to apply the fire safety order, in terms of looking at the protection both of commercial and sort of residential premises. We did start this work in May of 2022. We recognised that there was a potential in terms of more vulnerability and risky behaviours, which would lead to the increase of fires themselves. And the outcomes might increase in terms of accidental dwelling fires and fire injuries and fire fatalities. Now, a lot of that data, because we've majored very strongly today, which is really good in terms of the availability of data and the importance of data to drive an evidence-based approach to some of the work that we do. A lot of that information it will be feeding through the system as we look at it. So the way that we receive information around fire fatalities and incidents are through quarterly updates, and we expect that information to start to feed through the system to actually give us a more sort of a granular picture in terms of the risks and how they're being played out in people's homes, and also in terms of the incidents that we're addressing. But the risks mainly are around accidental dwelling fires, fire injuries and fatalities that we're concerned about. And more specifically, in terms of the incidents that we've already seen, these are some of the sorts of traits that are in the bullet point list there. So using alternative or unfamiliar and or dangerous heating methods. So quite often that is using equipment that's not purposely designed for cooking or heating in the household condition. And that has unfortunately led to a number of incidents we've seen in terms of both sort of serious injuries and in a number of cases fatalities. Alarms and detection, so people not being in a position to replace alarms and detection or not maintaining alarms and detection. Home reconfiguration or part use, where we've seen a growing trend in terms of people heating and living in certain parts of the household, which can lead to overcrowding, but also can lead to unsafe and unsatisfactory sort of combinations of different factors in terms of life, in terms of cooking, and in terms of leisure. Electrical safety, so in terms of people maybe not being in a full position to actually address electrical safety issues and maintain electrical safety. Bypassing of electric and gas meters, which has been much more sort of prominent in terms of our protection field, in terms of commercial premises. And we've done some stringent work with Cadent and other market leaders in terms of looking at alert systems for the shall we say, the implications, not only from a legal perspective, but also from a safety perspective, in terms of trying to circumnavigate electrical and gas meters. And obviously, sort of hidden sort of element of that is within domestic premises, which unfortunately we tend to find out about once an incident's actually occurred, as opposed to the preventative work that we do. Although we have taken a sort of strong line in terms of providing advice to households not to be tempted into looking at different methods of electrical and gas meter use. Tobacco use, specifically around the growth in terms of illicit tobacco use, obviously much cheaper methodology for people that are using tobacco, but obviously a lot less safer in terms of not being self-extinguishing and causing a significant amount of incidents in terms of tobacco-related or smoking-related fires, and cooking methods, as we've already sort of covered there, and people actually using different methods in different scenarios to actually cook unsafely on everything from camping equipment to barbecues to open fire pits. Have been sort of experienced with by local fire and rescue services, and we have a number of case studies, or although anonymised, can actually illustrate some of the issues that we've come up against, certainly in terms of this this winter period. Next slide, please. So in terms of what we've done to address this is we've released a comprehensive toolkit for all UK fire and rescue services in mid-September, which provided strengthened guidance for fire and rescue services around the prominent risks as we just covered there. And also looked at the way that we would actually communicate with members of the public to actually make sure that we were looking at addressing some behavioural issues in terms of people's sort of characteristics, both in terms of how they were both cooking and heating their households, but other issues as well is in terms of not maybe heating important rooms in the house, but also in terms of how they weren't communicating potentially with other agencies to say that they were potentially struggling. We developed a number of press releases, both nationally and social media, and we developed a range of case studies, and we've worked with local government specifically in terms of signposting, where fire and rescue service is still very good in terms of getting over the threshold and making sure that we're signposting individuals onto other sort of support mechanisms. And a tool that we've introduced, which is now in operation by 70% of English fire and rescue services, is an online home fire safety check, which specifically addresses people's sort of self-assessment and them understanding the potential risk throughout their sort of home, but also providing a really direct and real-time link into the availability of a one-to-one home fire safety check by your local fire and rescue service. Next slide, please. So that's just an example in terms of some of the messages and the graphics that we've produced, all under the hashtag of Stay Fire Safe. and we've distributed these quite widely now with local fire and rescue services, and they're being used not only by fire and rescue services but also being used by different agencies. There's a link with NHS Data and Digital to include that in their winter warmth sort of campaigns, and a range of other sort of public and private sector organisations have carried the sort of messages sort of forward. We've worked with UK Energy to make sure that they carry some of these messages as well. So these are things to do and things not to do, but just reinforcing some of our safety messages, but also recognising that there'd be different patterns potentially of behaviour. And mixed messages, as we've seen, especially around things such as running white goods and charging devices when you're asleep, which have been sort of out there, and a lot of messages that have been put out there on social media, which are not necessarily the messages that we would support as a fire service. So next slide, please. So just to give you an idea in terms of the work that we've done, national press releases went out in October. We did a specific piece with Martin Lewis, the money saver you'll be familiar with, in terms of fire safety films using firefighters to actually explain the actual risks of some, shall we say, shortcuts in terms of heating and sort of cooking in the household. We looked at an exclusivity deal nationally with the BBC that's been carried nationally on Breakfast News, but also in terms of local news channels, regional news channels, I should say, in terms of work to actually provide assurance, but also to provide sort of strength and guidance in terms of sort of safe behaviours and practices in terms of specifically around heating and cooking. And as I say, local fire and rescue services, a guide that's in the toolkit, and as I've already pointed out, the social media hashtag. So last slide from me, and I know I've whizzed through that, and really I'm sort of more than happy to take any questions directly or after this presentation. But the next steps were for us to actually work, and it comes back probably in a good place really in terms of the data. So it comes back to us developing a definition in terms of what we think are sort of incidents that are related to sort of financial hardship, or specifically in terms of sort of cost of living. And you can see the sort of definition, the working definition that we've applied now to our incidents recording system. And we're looking at collecting this data through post-incident questions by crews or fire investigators, recording responses and developing the evidence base, but obviously just recognising that this won't be just an issue that might affect us through the winter months, but it might be an issue that will carry forward certainly into 2023 and potentially 2024. And just to give you an idea in terms of where we are, in terms of the fire statistics for the year ending September 2022, which was released on the 9th of February, so quite recently, fire and rescue services across England attended 620,758 incidents. That was a 16% increase on the previous year. 185,437 of those incidents were fires. That represents a 28% increase in previous years. But that, if you can cast your memory back to it, it's a bit hard on a cold day like this, that was really around a 44% increase in secondary fires, a 63% increase in outdoor primary fires, which was related to the hot weather and the incidents that we saw around that. In terms of fire fatalities, 276 compared to 249 in the previous year. The cost of living impact we expect to be seen in the next quarterly review to start to come through, because that will be, admittedly, what we've had is not particularly harsh winter, but still in terms of people feeling the economic pinch, to actually look at the rates of incidents. The anecdotal evidence that we've got is that we're seeing different types of fires and we're seeing different types of behaviours, but that needs to be backed up in terms of the statistical evidence that we will draw from individual fire and rescue services to shape and develop our campaign platform going through to next year. So I think we're just past 2:30, and I know I've rattled through that, Nathan, probably a bit quicker than I would have wanted to, but thanks for the opportunity to present today.
No, Jed, wonderful, thank you. And there's again loads of information there, and unfortunately, lots of it learned the lessons from unfortunate fires and people's heartache. So, yeah, as people are dropping into the chat, you probably see they're really important issues. A question on your feeling or anything insight you can give about e-cigarettes?
Yeah, in terms of e-cigarettes, and one of the issues we've been seeing with e-cigarettes, and I would also add e-scooters into this and other mechanisms, is the charging packs and the availability of charging packs and the availability of counterfeit charging packs on the open market. We've seen a number of fatalities related both to e-cigarettes and to e-scooters, and they've mainly come through the actual charging devices. So that is a major concern for us. We've got a thread of work through the NFCC, which is around emerging technologies, and that mainly is looking at charging packs and also fuel sources. So emergent issues around fuel sources as well.
Thanks, Jed. Thanks. Yeah, that's something that our occupational committee are also interested in. So that's a great interest to us all. We can pick up that outside. Questions about linking to the graphical packs that can be shared from a couple of people. So if we can share those after the...
Yeah, I can make sure that if you've not already got them, we can make them available.
And yeah, requests for more information for electrical fires and white goods whilst asleep, whilst people are sleeping. But yeah, so thanks for running through at speed. Apologies for shrinking your available time there. My final takeaway point with that is I think you mentioned that the fire deaths have increased year on year, and it's just a measure of new and difficult pressures that people are seeing. So in summary, we've a lot of information in the past hour or so. You know, we've talked about safety equipment being given, you know, simple things, saving children's lives in particular, difficulty in recognising the cost benefit and how we measure the societal benefit, or actually the purpose of safety and the benefit of safety being safety in itself, but the value of doing that as a programme. We've talked about the difficulties, but the value in obtaining accurate data, and our need and desire to improve that and to continue that work, and that we don't lose the lessons and the information that is captured. Making sure that our standards, our laws and expectations are fit for purpose now and fit for purpose in the future, and that we don't lose anything that we've got, and they were designed for a purpose and implemented for a purpose, and that we keep those standards high so that we don't suffer fatal accidents and injuries to our family and friends. And then again, finally from Jed, as I mentioned, about different ways that people are using their homes, and fires and accidents are occurring. And I just struggle to write down the definition that you posted, but I will revisit that. I think really interesting. I've summarised it, you know, not recognising the risk or willing to accept the risk due to other perceived pressures, but there's more nuance than that, so I'm really interested in seeing that. So I think that's a really useful session. I thank you all for your time, particularly the presenters and you guys that are listening in and posting questions in the chat. The video will be available to you all post this. I'm not sure how long it takes to process, but it'll certainly be today. And please continue to get involved and try and work together to keep people alive. Thanks for your time, everybody.
Thanks very much.
Thank you.
Thank you.